everybody, this is Fungai, and I'm here to perform IV insertion on a patient. So what I'm going to do first, when I walk into the patient's room, I make sure that I introduce myself, and I have to wash my hands, perform hand hygiene, and provide privacy. I'm also going to identify if I've got the right patient by using two identifiers. I'm going to ask the patient their name and then their date of birth, and I'll compare to their hospital band, and I'll also compare to their file with the doctor's orders. So next step, I'll be gathering my supplies, and in this case I need an IV insertion tubing, I need normal saline, I need the extension tubing kit, and I need alcohol swabs, gauze, and transparent dressings, but in this case I'll just be using normal bandages. And I need a tourniquet, and I need hand sanitizer, and lastly my gloves. So the next thing, what I'm going to be doing is I'll be performing hand hygiene. And after performing hand hygiene, I put on my gloves. I make sure that I also explain the procedure to the patient, and if they've got any questions that I can answer, I'll be happy to give them the opportunity to ask any questions. And I also and after that, now I'm going to identify the vein that I want to use. I'm going to go for the non-dominant hand in this patient, and I'm just going to inspect the skin, the area, in case of any rashes, lesions, or any redness, soreness, or phlebitis, or any infiltration to the area, and I make sure that I don't go in those areas. So after that, after I've identified the area, I palpate the area just to see the vein that I'm going to perform the venipuncture. And after that, I'm going to take my tourniquet, and I'm going to go about 6 inches away from the site. I'm going to tie the tourniquet, and I'm going to tuck the top end away from the site. Then after that, I'm going to take my alcohol swab, and I'm going to clean the site, and I'm going to go in circular motion away from the vein, at least 2 to 4 maybe centimeters diameter, or maybe in a back and forth motion, at least the same diameter of 2 to 4 centimeters. Then after that, as I leave the area to air dry, I'm going to take the normal saline, and I'm going to connect it to the extension tubing. And after I've connected it, I then just set it aside in time for me to be ready. Then I place this absorbent pad just in case of any accidents or any spills. Then I'm going to take my IV insertion tubing. I'm going to take the kit out. So I'm going to enter the vein. Then I'm going to go in with the needle bevel up, and I'm going to go in at a 45-degree angle. Then when I insert the needle, I'm going to be looking for the flash. Once I see the flash of blood, I then go down at an angle of 30 degrees. Then I push in the tubing, and then I release the needle, and then push the tubing until straight into the vein. Then after that, I just support the tubing and take out the needle away. Then after that, I am going to inspect the area just in case of anything abnormal. I'm going to take my extension tubing and I'm going to connect it. Then I'm going to take my bandages. And I'm going to tape it in place. And I'm just going to flush the tubing just to see if there is no big flow of blood or anything. Then I see that it's running nicely. Then I'm just going to fold it backwards and secure it in place. Just next to where I've inserted the tubing. Just going to secure it in place. And after I've secured it in place, I'll just inspect the area. Then I'm going to leave the tubing either connected to the saline, or then I connect it to the IV fluids if per doctor's orders, and then I take off the tourniquet. Then I make sure I put the sharps into the sharps container, and I put the tracer away too. Then after that, I leave my patient in a comfortable position, and I just ask them how they tolerated the procedure, and how they are tolerating the procedure, and to see if there is no big flow of blood or anything. Once I make sure that my patient is comfortable, I then make sure that I document according to the facility's requirements, just to document and put the date, the time of the insertion, and the type of needle or of the insertion kit that I've used according to the facility's recommendations. Then yes, that's it. Then I take off my gloves, I leave the room. So now I'll be performing initiating fluid to the patient. So I come to the patient, I make sure I perform hand hygiene, I make sure I put on my gloves, I make sure I provide privacy for my patient, I make sure I explain the procedure to the patient, what I will be doing. So in this case, I'll be initiating IV fluids. So what I need to do first is I need to do the 3 checks before initiating any IV. I need to make sure that I have to make sure that I compare everything to the MA and to I have to compare everything to the MA. I have to compare with the doctor's orders. I have to also check the medication, the IV fluid that I will be running. I'll check the expiration date. I'll check the name, and I'll have to compare it to the MA before initiating any fluids. And before starting the IV, I need to also ask my patient about any allergies that they might have. Then after that, I have to make sure that I inspect the area first. So on inspecting the area, I need to make sure that there is no redness, no soreness, no infiltration going on in the place. Then I assembled everything that I needed. In this case, I need the 0.9% of sodium chloride, which was ordered by the doctor. Then I make sure that I do this. I check for the 6 right of medication before initiating anything, which is the right medication, the right patient, the right time, the right dose, the right route, the right documentation as well. So after making sure that I have all of that in place, I make sure that I take my IV bag and hang it. Oh, before I hang it, I make sure I get my bag. Then I make sure that I've got the tubing that I'm going to unscrew the tubing and make sure that I spike the bag, making sure that the tubing is locked. And after performing the spike, then I make sure that I hang the bag and before running it into the patient, I make sure that I check the medication, what the doctor then I unlock it to just check and make sure that I've got the right drip rate running into the tubing. Then after I've cleared all air bubbles, I make sure that I lock it in place. Then I'm going to connect the tubing to the IV fluid. Then I'm going to screw it into position. Then I make sure that I open according to the right drip rate and everything. Once the IV is running, I make sure that there is no backflow of any fluids running, and I make sure that my patient is comfortable. Then I also make sure that I also inspect the place, the skin around the IV, where the IV is inserted. Then after that, I make sure that my patient is safe and is comfortable, and I ask if they need anything else. So now I'll be performing the IV discontinuation of the IV. So what I do, first thing, I perform my hips just like what I did in the first part. I perform my hips. I make sure I wash my hands. I make sure I provide privacy. I make sure I've got the right patient, and I make sure that I compare. I use two identifiers to identify if I've got the right patient. They provide their name and their date of birth. Then I make sure that I'm doing the right procedure to the right patient. So after that, After that, I explain to the patient that I'm going to be discontinuing the IV and I'll be taking the IV off. Then I make sure I stop the running of the IV. Once I stop the running of the IV, I disconnect. Then I make sure I've got a gauze. I place the gauze directly over the IV and I slowly take off all the bandages, or I make sure that I take all the transparent bandages. Then after that, slowly I take off the needle, slightly pull out the needle. After slightly pulling out the needle, I hold pressure to the side and I place a bandage over it. After I've placed the bandage over it, I ask my patient to lift up their hand so that we can initiate clot forming. Then after that, I inspect the side, and just maybe if the wound is still bleeding, if the site is still bleeding, then I make sure I tape it in place. Then when I make sure that the patient is fine, the skin area is fine, then I finish up by washing my hands again and by documenting what I've done, and yeah, leaving my patient safe, which is the most important part. Then the last part, I am performing just monitoring the sides, the IV sides, or how you maintain and monitor the site. So when the patient has got an IV running over it, you evaluate it at least for 8 hours for any infiltration, for any problems, redness, soreness, or maybe if there's edema to the place. So I make sure that, yeah, when I come back into the room, I perform all those lifts, I wash my hands, I explain what I'm doing to the patient, what I'll be doing to the patient, that I'm just here to monitor their site, which I'm supposed to do every 8 hours. This is supposed to be done every 8 hours. And I make sure that the transparent dressings are still intact, and then there's no blood around, or there's no edema, or there's no infiltration to the site. I also make sure that if it's just checking, I'll be checking just in case the IV was still inserted. I make sure to check it after every just to maintain the tubing, or maybe to change it after every 72 to 90 every 72 to 92 every 72 to 96 hours, maybe, and rotate the place just in case there are problems to the side. But if the doctor does not say to rotate the place, then it's supposed to be checked at intervals of every 24 hours, just to check on the side. Then yeah, that is all for my video. Thank you.